Good morning, Peter Goertz. I'm a psychiatrist. Is mental illness a myth? Is psychiatry perfect? Absolutely not. There have been abuses of power in psychiatry and many other problems. I'm tempted to ask, I don't think this is practically possible, but I'm tempted to ask people who believe that mental illness does not exist to come to an emergency room. So I'd like to invite them to an emergency room to see agitated, psychotic, violent, demented patients, patients who are suicidal, patients who've attempted suicide, and see if they can help those patients, what their feelings are when they see those patients. Instead of focusing on academic, philosophical, semantic issues, it might be better regarding this topic to focus on common sense. There definitely is not a biopsy to diagnose schizophrenia. There can be social, substance use factors involved in creating mental illness. There can be psychological trauma, head trauma, so physical trauma. But the bottom line is, in my experience, in my opinion, patients are suffering, and that actually is the original meaning of the word patient, sufferer. And their loved ones, people around them, are suffering sometimes in major ways as well. So it may be disrespectful to patients and to family members and people who know the patient to say that mental illness does not exist. A few examples of patients who I saw recently. One patient became psychotic after the death of a family member. And I was talking with the patient. He was saying, there's no problem at all, no reason for me to be here, I want to go home. And I spoke with his wife, and when I asked her how she was holding up, she started crying, and she said she's not sleeping, the patient is disruptive, and she's barely getting by, barely able to function at work. So a lot of distress, not just for the patient, but also for people around them. Another patient stopped his medications and became quite psychotic, troubled, and the woman whom he was living with ended up not being able to sleep at night because the patient was up at night, and she actually went to a hotel. So again, not just the patient being in distress, but people around them. The woman who lived with him was not able to sleep in their house, and she ended up going to a hotel. A third patient came in with suicidal ideation, homicidal ideation, and she'd been through a lot of abuse in childhood. Sometimes I get the sense when I start asking, while I'm asking the question about abuse in their life, I kind of just get a sense sometimes that they've been through all of it. So in this patient, I asked, have you been sexually abused, physically abused, emotionally abused, or all of that? And that's the way I asked the question with her. And she just nodded, all of it. And we didn't have to go into detail. This was a patient in the emergency room. But definitely, sometimes I get the sense that people have been through a lot of abuse. And it turns out, from what I could tell from talking with that patient, that she had dissociative episodes. She had time that she did not recall. And she even had the name of someone whom she turned into, an alter potentially. So she may have been actually suffering in part from dissociative identity and may have been switching at times to a different personality. And that's the way she described it. When so-and-so, the name of the person she switched in, comes out, she gets, I think she said maybe very mean or acts in a very different way from the way the patient would usually act. A fourth patient had enormous stress financially. His girlfriend left him, stress related to his son, and he had changed in such a major way that people were concerned, the doctors were concerned about a neurological issue. So he He was seen by neurology in consultation. He had a CAT scan of the head done. He even had an EEG done. And I don't know the results of the EEG, but until the EEG, things were non-contributory as far as evaluation for any neurological or medical issue that would explain the change in mental state. And from what I could tell, he was just plain severely depressed, to the point where I was concerned that he might have suicidal thoughts. So again, a lot of people who we see that are really suffering. So it doesn't seem fair to me to say that mental illness does not exist. And we want to have an open-minded approach. There are various approaches to treating people with mental illness: medication, psychotherapy, maybe diet, meditation, yoga can help, Tai Chi, acupuncture, and other approaches. So there are many different approaches, but a lot of people who are very troubled emotionally come and ask for help, and we want to be open-minded and creative in giving them help. And we also want to give them as much autonomy as possible. What I tell patients is that if there's no emergency, you're in charge. So you don't have to take this medicine, you don't have to come for visits, you're the one in charge. But if there's an emergency, like if you tell me you're gonna go kill someone, then I have to be in charge and I have to put you in a hospital, for example, in that situation. And it's analogous in other fields of medicine. You know, if someone has a major physical trauma, they're bleeding potentially to death, then they're not in charge. Someone else, the doctor or EMT, has to take charge and try and make sure they survive. And we want to avoid denial, in my opinion. We want to avoid denying that mental illness exists. Again, there are many people who come to us in psychiatry who are desperate for help with emotional suffering. Thank you.